So first up in the weekly news roundup, we are going to talk about dystopic health startups, because all forms of health startup apps are starting to creep up all over the place, and they are crazy and they are creepy and they are things I would highly recommend you not use. Isn't that wonderful? And so we will, understand this. When Fitbit, I think, was one of the first one of these types of applications came out, I originally looked at it and said, that would be kind of neat. I like doing health tracking stuff. And, I like going in and saying, hey, how many steps did I do today? And what was my heart rate looking like? And things like that, right? And I started looking into Fitbit, and I see everything like, you got to have the Fitbit account. And I'm like, even then I wasn't full-fledged into the privacy and security arm of the world, but at the same time I was like, something in my soul just wasn't comfortable giving all that data up to some app on a phone, because even back before the Graphene OS and before Lineage and back when I was using the normie phones, I still did not like apps and tying into it. I mean, I am the furthest thing from a phone addict. If you're addicted to your phone and you're looking for solutions, I can't help it. I can't even relate. There are times I forget my phone is even here. I mean, I use it as an alarm clock in the morning. I use it to collect the news articles for the weekly news roundup. And now since I got the Garmin Forerunner, I use Gadget Bridge, which allows me to sync it like once a day. But I don't have any other basic apps installed on the phone. I don't do banking over there, and I don't think you should either. There's just too many problems with the phones. And so I was looking at that going, I don't really want to do any of that. And then I started looking into it further and further. We're still going back over a decade ago. And I look at Fitbit and I go, businesses often have an exit strategy, and their exit strategy is going to sell to the highest bidder, and their highest bidder may very well be a health insurance company, which a health insurance company would pay top dollar for that, because it gives them a whole lot of information in the actuary tables. Like, oh, this guy over here, he says he weighs this much and he's in tip-top shape, but I can see from the app that he, sits on the couch eating potato chips, watching the latest reruns of whatever the current TV show is. And, he's not getting a lot of sleep. He might have sleep apnea, and there's other issues that we can detect from it. I don't know. Well, who ended up buying Fitbit? Do you know? Google. Well, technically Alphabet. As working on Alphabet, working on a health insurance company. So I was sort of right. I was sort of wrong. Not an established health insurance company, but one that really wants to use that type of health data. And so even if you trust the company that has the health data that your devices are collecting on you, it is still, you still have a reason to be concerned. And that's one of those things that I wanted to mention. But this leads me into a couple articles I found this week. And that is, of course, the founders of Fitbit, after making millions of dollars selling their app to Google, they are back. Now they want to track not just your health, but everybody else's health. This is following along a very disturbing trend I've talked about recently. And that is that it's one thing if you want to give your own data up, but there's been this big trend lately of companies now allowing you to input other people's data into your account. You look at Ring, and we talked about this, where Ring now has a new feature that allows you to program in people that so you can say to Amazon, oh, this person coming up, this is my mother, Amazon. Wouldn't you like to have that for your Flock database? And now you have this direct connection, and then they pass on to Flock, and then they can track your mom around the world, and they know it's your mom because you told them, and I think it should be completely banned to have your distraction box contact list syncing with any app. I think that should be completely illegal. I think we need regulation against that, because I didn't consent to you to give my name and my phone number to Facebook. Why did you do that? It is my data. I should have the freedom of what is over there, and any data that is passed on that I did not directly pass to that company should be illegal for that company to have. Period. We need to banish data brokers, all of them. But the thing is that it is becoming more popular to have these types of things so that you could now utilize their new health app, and it doesn't monitor just you. Now it monitors you and mom and the kiddo and even the dog. The dog is in here. You pet parents. Don't get me started. Yes, you can include your dog in the Fitbit health app. Go on figure. All right, so the founders, James Park and Eric Friedman, have announced the launch of a new AI startup called Lufu. And I'm laughing all the way. It's Lufu, I think. I don't know. Luffu. I swear they've run out of names for things, so they're like playing Scrabble or pulling letters out of a bag. Luffu. Lufu. Let's call it Lufu. Go for it. Why not? What's in a name? So this is to aim to help families proactively monitor their health. Now, I am all for proactively monitoring your health. Okay, I have a blood pressure cup. My blood sugar kit broke, so I'm gonna need to buy me a new one of those. I mean, sure, that $20. I paid $20 for that thing like a decade ago. I need a new one. I am okay with monitoring your health. I like the Garmin Forerunner because I don't have to connect it to any Garmin app. It's never been on the internet or connected to any internet connected app. But I can still track the data. I can see how I'm doing. I have not yet figured out how the watch figures out I'm stressed because I have literally done this twice now. I'm sitting back. The other night I was sitting back. The day was over. I'd accomplished a lot. I was literally sitting there watching the last bit of the sun go down over a mountain. The stars are coming out and I am eating some cookies, just going, oh, it's so quiet and peaceful. And my watch beeps and says, hey, you're stressed out. I am not stressed out. I am anything but stressed out. Okay. But isn't that interesting? What if my watch, which for some reason thinks I'm stressed out a lot, and I'm not a screaming, raving lunatic most of the time, just when I'm live over on this YouTube channel, right? If you actually know me in person, I'm very calm and very quiet, actually. I don't like a lot of noise. It's kind of interesting. But the watch keeps on saying you're stressed out, and I have no earthly idea why. Like, oh, look, my heart rate's low. Everything's low, but the watch has this stress score. Well, what if this stress score keeps on going up and pinging onto somebody's database? Health insurance company gets a hold of this and goes, this guy's always stressed out a lot. I mean, this is a heart attack waiting to happen. I don't know. I could be a heart attack waiting to happen. I don't know. Everyone in my family's died young. I don't know. But they've all, smoked like they were on fire and drank like they were trying to put it out. So how much does that go into it versus a guy who's midway through his 40s and still runs a mile several days a week? I mean, there's a radical difference between that. I also eat real food. I know it's a weird thing, but that's the thing. But now these guys they have their exit from Google. They decided they're betting on AI now to help lighten the mental burden of caregiving. Oh, how horrible it is to get your mental care. So Lufu, I'm just going to call it Lufu. Is that okay? This is laughable. Lufu uses AI in the background to gather and organize family information, learn day-to-day patterns, and flag notable changes so families can stay aligned and address potential well-being issues. That's all we need. AI to be spying on our health in the background, probably on someone else's server. All right, so I was caring for my parents from across the country, trying to piece together my mom's health care across various portals and providers with a language barrier that made it hard to complete timely context from her about doctor visits. I didn't want to constantly check in, and she didn't want to feel monitored. Lufu was the product we wished existed to stay on top of our family's health. Know what changed and when to step in without hovering. So there are some highlighted things I want to talk about. Okay, so first, a language barrier. Language barrier with whom? This is your mom, right? Is it language barrier with the doctors? I am completely confuzzlicated on what you were saying as a language barrier. Something doesn't work, guys. 2 + 2 no longer equals 4. You're either having a language barrier with your mom or your language barrier with your mom's doctor. Maybe if you're having a language barrier with your mom's doctor, maybe this isn't a reason we shouldn't have people here who can't speak English. There's a thought. But what language barrier are you talking about? It's your mother. If you have a language barrier with your mother, I mean, I understand, but come on. Okay. Second, she didn't want to feel monitored. She didn't want to feel monitored. So let's have an AI watch her perpetually in the background. Well, that won't make me feel monitored. Talk about cognitive dissonance. This is insanity. The hell's going on with these people? All right. The real life health is shared across partners, kids, parents, pets, and caregivers. Yes, we have a giant collected database sharing all forms of health information all over the place. Well, if that doesn't sound like a target for a hacker to go after, no thank you. I'd rather keep my basic health stuff on my phone, where when it says I'm stressed out, I can look at it and go, are you smoking crack? What? Jeez. Sitting down watching a sunset while the stars are coming out, eating cookies is not stressful, okay? But the last thing I need is for the AI to think I'm stressful and start alerting doctors that you might be stressed out. You might be stressed out. You might be stressed out. It's kind of like that fun story. I've told it before. It's so funny, but it's health-related stuff. So I had a tooth infection, right, at one point in time. And I knew I had a tooth infection, and I couldn't get in to see the dentist. Well, the local urgent care center wanted like $300 just to walk in the door. I'm like, that's ridiculous. I don't need a diagnosis. I have a tooth infection. Like, look, see, it's infected. Oh, here's an antibiotic. Okay. So I'm like, okay, let's just pop some more Tylenol and go, because I had a conference in Texas. So I'm driving down the way. I leave the home. I drive straight. I'm up for 20 hours. I drink 2 pots of coffee, up for 20 hours with an infection in my tooth. And it's getting bad again. And the Tylenol is not working. So I stop into an urgent care in Amarillo. It's like a university urgent care. It only costs like $80 to walk in. Great. Awesome. Let's walk in, pay my $80, sit in there, and I get one of those. They don't even say a doctor. It's one of those PAs, probably a student, looking at everything going, well, you know, your blood pressure is pre-hypertensive. You might want to start thinking about medication. Pre-hypertensive blood pressure. I had a 185 over 82 on 20 hours of sleep, 2 pots of coffee, and a tooth infection. Should I sue this woman for malpractice? I mean, what are you thinking? But probably somewhere in some health record of mine, potentially hypertensive, pre-hypertensive, because this is just all their thing to get you on medication. Because that's what pharmacology these days. It's not about healthcare. It's about how can we get you into the system on a perpetual medication. So I'm like, no, you're a moron. Okay, give me like, look. She looks at it and goes, wow, your tooth is infected. Duh. Here's an antibiotic prescription. Okay, great. Go to the local grocery store. They actually fill the antibiotic for free, which is cool, because they figure, hey, you fill it for free. It's going to take an hour to fill, and it was so cheap, and they'll figure you'll go shopping. Looked like a good deal. I picked up some things I might have wanted for some snacks for the conference. Go over, get my free prescription, start popping pills. Guess what? My tooth feels great again. And, subsequently after that, I've since taken my blood pressure several times since then, and I'm still sitting at that very nice, was it 120 over 80? I think I said, it's 125. I think I said 185 over 80. No, it's 125 over, it's like 5 over on the systolic. And so, of course, everything's normal because I don't have high blood pressure, okay? Even when I'm ranting like this, it's crazy, but I don't have high blood pressure, all right? So I don't, though, need the watch to be sending information up that some health insurance care provider says, well, your watch said one time a while ago that you were stressed out, and it's done this a couple times, and so we think that you're stressed out. So we think you're a higher heart attack risk, so I think we'll put a little higher tier on this or something like that, No. So you won't be monitored, so you'll be monitored by the AI because you have the language barrier with your mother. And that's all laughable, so you get Lafu. Why not, right? So, Lufu proactivity watches for changes. Wonderful. And it alerts people of those changes. So there is one dystopic health startup that I really want nothing to do with. But there was another one. This is Lotus Health. They captured $35 million in seed funding for an AI doctor that sees patients for free. You've heard the old adage that if it doesn't cost anything, you're the product. Yeah. So would you go and talk to a free AI doctor? This is interesting. So a growing number of people are now asking ChatGPT and other LLMs about their health, often discovering that the chatbots provide remarkably useful medical insights at the wonderful cost of sending your data up. And so with that happening, then ultimately people are using it more. So the inefficiencies of the U.S. healthcare system, of course, he recognized this ever since he's a child, acting as a medical translator for his parents. Once again, we have this language barrier going on. Again, if we just all agree to speak English, maybe we'll be in better shape. I don't know. And then, of course, now he launches Lotus Health AI, a free primary care provider that's available 24/7 in 50 languages. On Tuesday, announced it raised $35 million in a Series A round co-led by CRV and Kleiner Perkins, bringing its total funding to $41 million. Moves beyond those chats to facilitate actual medical care, including diagnosis, prescriptions, and specialist referrals. They do want to bring in real doctors to evaluate, and when real doctors are evaluating the AI's decision, then we might actually have a situation where the doctors start losing efficiency. I want the doctors to be doing this. I don't want AI to be doing this because I want the doctor to have the experience. Even if it's the 100th case he's seen about some common thing, I still want him the experience of doing that from time to time so he doesn't forget some of the basics. So effectively, though, they are bringing in an AI doctor that functions like real medical practice, equipped with licenses to operate in all 50 states, malpractice insurance, HIPAA compliance systems, and full access to patient records. All for free. Now, the only saving grace here is if it's HIPAA compliant, it can't do all the data brokerage it would want to. But who knows? It might want you to sign away on that. I don't know, which you can. You can sign away on COPA. I think you might be able to sign away on HIPAA. If not, you can expect that to be a carve-out put in there pretty soon. The company's always had board-certified doctors from top health institutions such as Stanford, Harvard, and UCSF review the final diagnosis, lab orders, and medical prescriptions. And so AI is giving advice, but the real doctors are actually signing off on it. And if a case requires a physical examination, it refers patients to an in-house physician. So now we are going to build an AI system that now has a network of Walmart-quality doctors inside of a giant network. So you can use the AI. It says, hey, I think you need to see our Walmart doctor. And then you get a chance to go out there. I remember when Walmart was doing that, actually having doctors in there, like doing like full exams and stuff. Yeah, kind of weird thing. I had only heard about it that once. I haven't heard much about it since then. So primary care doctors are in short supply. Lotus claims it can see 10 times as many patients as a traditional practice, even when it limits each visit to 15 minutes. I wonder why that is, because one centralized bot. But there are other ones. So Lightspeed is another one of these competitors, but Lotus is saying ours is completely free of charge. Yeah, completely free of charge means that you are actually going to be the product here. Now, the thing is that a lot of these health applications, this is from July of 2023, but a lot of Americans think that just because something like your Fitbit collects health data, they think it's HIPAA compliant and it's covered by HIPAA. And the reality is that is not actually the case. So there is a common misconception that HIPAA applies to health apps. However, the majority of health apps are not covered by HIPAA, nor is the health information collected, stored, or transmitted by the apps. Actually, though, it is true that many of them do collect and store and transmit data. In fact, almost all of them do. So I'm not sure about that particular part. They say health information collected by health apps may be transmitted by third parties, sold, or used for purposes that are not permitted under HIPAA because they are not HIPAA. Okay. According to Clear Data Harris Poll survey of 2,000 U.S. adults, 68% reported they were very or somewhat familiar with HIPAA, yet 81% of respondents believe the health data collected by digital health apps is covered by HIPAA and is subject to its privacy and security rules, which is not true. They also revealed health information privacy is not a key factor for Americans when choosing personal health apps, which is why everybody runs around with a device constantly sending all of their health biometric stats up to Google. Go figure. And 58% of them reported to have used digital health apps, said they had not considered how the information entered into those apps would be used. And this is our biggest problem, is that too many people, you either are aware of this and are conscious about it, or you're not, and you give other people's data to these big companies too. So HIPAA does not apply to most digital apps. Digital health companies are required to comply with FTC Act, which must notify consumers in the event of a data breach of Health Act under the the health breach notification rule. So there's a special FTC rule that specifies that you must be alerted if your health information is breached, but it's not held to the same standard as HIPAA. So it turns out that the FTC actually has an interactive tool allowing you to determine if your app falls under HIPAA rules or not. And it's just a series of questions and answers. So it's going to ask which federal laws apply. Does it collect, share, use, or maintain health information? There's either a yes or a no. If it's yes, then it does app fall within the HIPAA rules. So it kind of explains as to what these things are, basically identifiable health information. And many people get around this by saying, well, they de-anonymize it, even though that's easy to do, easy to undo. So there's a whole checklist apps can go through to figure out, or maybe engineer their app so they're just on the edge of that without actually qualifying for HIPAA. It does turn out Fitbit is actually HIPAA compliant. So if you are worried about it, Fitbit is HIPAA compliant. I still don't trust it because it is a product of Google sending all of your health data to Google servers. And I just don't trust that. It's Alphabet, like I said, technically. But the point here is that there's all of these health apps coming on down the pipeline, and too many people involved in these health apps, they don't even think about the downstream consequences of giving this data up to a big company. They don't think about what happens if that company is sold. What happens if the company goes bankrupt? You know, what happens if they end up buying or selling or sharing? What if they have a rogue internal person? I mean, just think of it. A rogue internal person at Fitbit could pull up the logs of somebody and see where they go based on location data. I mean, it is that frightening, which is why some of these devices have been banned from military bases, because you could easily see where the military was in their database. There was a couple of those that fell under that. So my point here is that you have to be extraordinarily cautious on any of these apps which are collecting data, health data on you and transmitting it to a company's server. So that is what my thoughts are. Let me know your thoughts about these. The full stream is linked below, as are the articles will be down below. So thanks for watching, and I hope that you enjoy switching to Linux.